I'm a GP, I work in SITCUP. I became politically active when there was threat to another local hospital where I work, after we'd already suffered the downgrading of Queen Mary's in Sidcup. There was a threat to Lewisham, which was just down the road. And almost immediately I was starting to see the impact on my patients. And I just could not figure out how a government with the best interests of its population could even consider such a thing. Then I embarked on a steep learning curve of how groups work, how groups are misdirected, how propaganda works, and how the media works. So I've learned more in the last 4 years than I did at university, I think. The conclusion is, actually the last 20 plus years, where the health service is concerned, no government has acted in the public interest. Okay? In 1997, Tony Blair said 7 days to save the NHS. But what's happened over the last 20 years, the money has been going in, the service has been improving, although the beds have been shrinking, but behind the scenes, the infrastructure for the demolition we are now seeing was put in place. The connection with the health professionals and the running of the service was broken, and we had a toxic layer of bureaucracy. Now, as it happens, this has happened across the public sector. But what we need to realise is either you pay for healthcare in the most efficient way through general taxation, or you dump the burden on the individuals and you go to private insurance companies. Now, these are not charities. They are in insurance to do one thing, and that's to make money. So how do they make money? Well, they make money by dumping you when you become sick and expensive. Okay? If none of you have watched Sicko, the documentary from 2007, it's online, you need to watch it. We are told very little about how the American health system works on our TV. All we hear is the newest, latest technological advance, but we don't hear about the 30 million people who have no insurance. Neither do we hear about the dumping of the sick. So these companies not only dump you when you really need them, but they also have what are called out-of-pocket expenses, deductibles. So before you can even access your insurance, you have to cough up $5,000 and upwards. So this is a barrier to seeking care. Fraud is endemic in the American system. There are 2 recent Department of Justice lawsuits against United Health, which have been launched for them defrauding the government. They have a Medicare system which subsidizes the elderly, and they have been systematically defrauding that to the tune of tens of billions. Now, this fraud began while Simon Stevens, who's now running NHS England, was a senior executive in United Health. Why are we not being told this? There is another company that is already set up in England called Netcare, which was involved in the illegal kidney transplantation of poor children, I think from Brazil, taking their kidneys and transplanting it into rich people from Israel. These companies are working in your NHS. Kaiser Permanente is another insurance company, which actually developed the system, and the guy who developed the system said the way to make profit is to deny care, and that is coming your way. So that's how it works. So even the most selfish person should realize that insurance is no insurance at all. When you really need it, they'll pull the plug. The other way they make money is to downskill, is to replace doctors with nurses, to replace nurses with HCAs, and to replace HCAs with volunteers. That's coming. And that's what the junior doctor contract's all about. Their contracts have made them more precarious, they have no whistleblowing protection, and if they make a mistake when they've overworked and tired, it's on their shoulders. That's in the contract. So that's why we have a brain drain amongst doctors leaving the country. Media. Okay, so we are being told time and time again that the NHS is unsustainable. That is a big lie. The more time that gets repeated, people start to worry, oh, it's unsustainable. That's complete BS. Yeah? It's the most sustainable health system in the developed world. Another lie is that we're living too long, and we can't afford people living too long. That's nonsense. Irrespective of the age you die, you cost the most in your last year of life. Either a 5-year-old, if you're unfortunate to have some rare cancer, in your 40s or in your 90s. You are the most expensive in your final year. So this is another bogus myth that is peddled out time and time again. And the private sector efficiency. There's nothing efficient about the private sector except extracting profit. They are extremely efficient at extracting profit. So how is the system run? I applied to be a CCG chair. At interview, I was asked whether I was prepared to do things that were morally repugnant. They stream out people into these CCG positions of power. I tried again 2 years later, and basically the gist of the questions were, are you prepared to lie to your fellow colleagues? The system has been corrupted, and it is dangerous. I was also offered a bribe to take another lower level job and keep quiet. And I was also threatened by a manager not to rock the boat. So this is why more doctors and nurses aren't able to come out. There is a culture of fear and intimidation, and this is why we cannot, a lot of us, speak up. One of the most saddest things is I thought when it came to patient interest, we would all act loudly and together and defend the patients. But only last week, because of budget cuts, because of practices struggling, the GP body has voted to consider co-payments. Co-payments are patient charges, and we know the evidence. If you have patient charges, they delay seeking help. So the profession has been manipulated into actually sowing the seeds of their own destruction and destroying the doctor-patient relationship. So I won't say any more, and thank you very much.
I'd just like to